Marco Johnny here. I am with Alexandria DeVito. Today we're going to be talking about pre and post pregnancy nutrition, how to grow a healthy baby, how to get pregnant too. So we're going to dive into this topic today. Alexandria, nice to meet you. Welcome to the podcast.
So nice to meet you too. Thanks so much for having me.
Awesome. Well, first off, how did you get into this field? I mean, this is a unique field because fertility issues and pregnancy problems are on the rise. Conventional medicine doesn't really have a lot of options outside of IVF and people full of Lupron and Follistim and Clomid, and there's not really a focus on avoiding toxins and getting healthy and nutrition and diet, and the general diet recommendations tend to be kind of more of that conventional food pyramid, which we kind of know tends to be compromised by big food industries that sell a lot of processed food and junky fat. So how did you get into this field, this focus?
Probably in a fairly non-traditional way, which is that, I started working in and around healthcare first as a healthcare consultant. So I worked on the corporate side with a lot of pharmaceutical and med device companies. And that was kind of where I started my career. And then I fell in love with healthcare from that experience. And I felt like I wanted to switch from a more reactive model of healthcare than what I was observing to a more proactive one. So that was the impetus to go back to school. I went and got my MBA from Harvard. And then I also did a part-time master's in nutrition on the side to add more tools into my toolkit. Was the goal. And then I transitioned into clinical practice. I did training as a functional medicine practitioner and ended up working with a lot of clients that were struggling to conceive and, was on the receiving end of a lot of the recommendations that you were talking about, where people were struggling to conceive for years and years and they had no idea why. And they were kind of being given the runaround between a variety of different providers and they still weren't able to get pregnant and they had no idea why. And it was just gut-wrenching to watch.
Absolutely. And you kind of focused on nutrition the last 30 or 40 years. In the 80s and 90s, we kind of had this low fat era. And then we've kind of brought in the last 10, 20 years, a lot of junky fats. And then there's a lot of calorie counting. And then, lower animal protein's bad. And then too much carbs, a lot of the carb recommendations have gone up over time. What's your general dietary approach? I mean, people have kind of been pulled in a lot of different directions the last 10, 20, 30 years. How do you navigate that? What's your general dietary framework that you're trying to outline for the patients that you work with?
Yeah. So I would say, to me, a fertility friendly diet is generally speaking higher in fat than most people would anticipate. And that includes animal fats to the point that you were making earlier. Usually moderate carbohydrate and moderate protein. And there may be some instances where we need to modify that depending on your particular instance, right? If you're having trouble with blood sugar regulation, we may need to make some modifications. If, you are post-surgery for some reason, right, then we might need to make some protein changes. But generally speaking, that's what I like to talk about, opting for whole foods, balanced nutrition, right? And nutrient density in particular, right? Getting pregnant, sustaining a pregnancy is the most nutrient intensive time in a female's life. And so it's really important that what we're doing in the couple months in particular prior to conceiving is what's actually going to be feeding the development of that baby. So being particularly conscious about nutrient density in the period of time in preconception, but then also in pregnancy and postpartum, I think is something that doesn't get enough attention. And I think in nutrition, we spend so much time talking about what not to have. We don't actually spend a lot of time talking about the upside and the things to include in. So I like to talk a lot about kind of, okay, well, what are the sorts of things we want to be including in, nutrient density being one of them.
That makes sense. And if you look at hormones, right, almost all your hormones, with the exception of growth hormone and insulin, they're all going to be cholesterol based. So all your steroid hormones, progesterone, estrogen, they're going to have a cholesterol backbone. Cholesterol is so important, your body will make it. Ideally, if you get it from food, it'll save your body a lot of resources having to make it themselves. And that's the backbone for everything. It goes cholesterol, and then you go downstream to pregnenolone, and then it trickles downstream to your estrogen and your progesterone and all your DHEA and all your fertility supporting hormones. So cholesterol, very important. And then, of course, adding in lots of synthetic hormones, glyphosate, pesticides, antibiotics, a lot of that probably has a big impact as well. So talk about like the food quality. You mentioned, nutrient density, which is important. If you look at a lot of the nutrient kind of counters, a lot of times they penalize the saturated fat in animal products. And so when you actually look at the equations and how they base the nutrient density, once you factor out a lot of the saturated fat, egg yolks are amazingly nutrient dense, like grass-fed liver, amazingly nutrient dense. Talk about like what food, like the food quality aspect, and what talk about the toxins that could be in food, maybe that could impact fertility.
I think you already gave such an incredible summary, and I think it's so important. Right? I don't think people realize this cholesterol, saturated fat point that you were making, which is that our sex hormones are being made from cholesterol. So we've demonized cholesterol, we've demonized saturated fat for a really long period of time, and I think that's caused people to shift their consumption away from fat. But it's incredibly important to maintain appropriate hormone levels, and if we don't have the raw materials to make our sex hormones, we're definitely not making, getting regular cycles, never mind making a baby. So I think it's such a foundational principle that you just mentioned that I don't think is really well understood. And then I think, a lot of the other pieces around, nutrient density is, we tend to be eating more food-like substances and less actual food. Right. So things in their raw form or their real form, and not only raw, right? Because we want to get a combination between like raw forms and cooked forms, because certain nutrients are more bioavailable when they're raw versus cooked. And so, just being conscious of these different things. So balance in a lot of different ways, I think, is an important piece of this puzzle. You were also making a point about like, what do we want to be conscious of not including? Yes. I mean, if we're trying to balance our own hormones, getting a huge exogenous source of hormones from another animal is probably not a good idea, right? It's going to mess with our own system. So if we just think about it simply, right, we don't want other hormones messing with our own. So minimizing any hormone, like products that have added hormones, minimizing products that have added pesticides and herbicides, right? All of these things. I mean, there's thousands of known endocrine disruptors, and they do exactly what they sound like. They mess with our endocrine system. And so, when you're trying to work with your own hormones, and then you have all of these things that are basically competing with your own hormones for binding and signaling, that confuses your body, and then your hormones that are produced in your own body don't function as optimally as they could, and that makes it harder to get pregnant, stay pregnant, right? Nurture appropriate menstrual cycles, and so forth.
Yeah, I mean, absolutely. You're going to have hormones in animal products if it's synthetic, or if you have a lot of, conventional type of animal products. So getting grass-fed, pasture-fed is going to matter. Also, water and plastics too. Let's dive into that, because I mean, I've seen an article by the Texas Tribune, I think in 2018, that 10 million households have elevated levels above the EPA safe threshold of atrazine, which is an herbicide that can really mess with the endocrine system. And so I recommend everyone, they should be drinking out of at home a reverse osmosis filter that's going to at least pull a lot of those toxins and microplastics and things out. Obviously, you got to add additional electrolytes out because they can lower the electrolytes. But hey, I'd rather have toxins out and add electrolytes back. A lot easier to add those things back. Let's talk about water and plastics a little bit and fertility.
Yeah, I mean, so these are such important pieces, because we're drinking water and we're showering in water. I think a lot of times people think about like the water that we're drinking, but there's shower as well, or we're like kind of dousing ourselves in chemicals. And so I did in one of the things is I looked at all the compounds that were in the drinking water of the town that I grew up in, and I was horrified by it. I mean, it's just all of these different compounds, and people can check their own local water sources. And so right, we can't necessarily control all that's going on outside of our homes necessarily, but our homes are, and potentially workplaces, depending on kind of where you're working, may be places that we have agency over. So installing water filters, installing both water filters on your drinking water, but then also your shower water as well, is just a first step in minimizing these compounds, so that you're not bathing in them and drinking them all day, every day. Same thing for air as well, right? Air filters is another place, right? So you think about air, food, water, those are big ones. And the air quality in homes is another, place that we want to be conscious of. And so, especially like when I'm cooking, right, I see all of these things are, being kicked up by cooking. So making sure that you have an appropriate air filter is important as well. And then plastics, right? That's a big one, because plastics are known to mess with our endocrine system as well. Right. So you have like parabens, you have phthalates, these are in fragrances, these are in, the product water bottles, right? But I think the more insidious ones are ones that we don't really know about. Plasticizers are used in, to make things flexible. So they're used in a lot of different places. And in small quantities, maybe not that big of a deal, but they're so pervasive that it's, really, really can be really hard. So watching our own consumption of, are we conscious of, what we're drinking or eating food out of? Can we remove the plastic and replace it with glass in as many places as we possibly can? Can we minimize the places where we're heating plastic and then either consuming it or putting it in and around us? So I think, there's like some of these general precautions to be conscious about when we're thinking about these external sources of things that can mess with our hormones.
Yeah, if you're going to a store and you're getting some water because you're thirsty and you're on the go, I always recommend doing glass, whether it's like a Topo Chico or a Gerald Steiner or a Mountain Valley. These are all going to be good options just because of the heat and releasing plastics. I mean, the worst place you can go, I find, for plastics is like general stores or convenience stores, because it's very frequently you walk by and you have a pallet of plastic out in the hot sun. It's like, oh man. Or just, is that truck that brought them over there like 100 degrees in the back, right? Those are all the questions you have. So go glass whenever you can. If you're going to buy plastic, probably go to a health food store that's more likely to keep it inside and keep it cool. But general thinking on that front, that's some good, simple ideas. I know what you're saying. Like, you can't do it right all the time, but you try to make good, healthy choices. Anything else in the toxicity realm you want to highlight? We hit plastics. We hit some of the xenoestrogens. Oh, also, if it's BPA free, well, guess what? It just means that
Yes.
there's BPS in there, not BPA. Like, it's still going to be a problem. So ideally, you still want to have plastics out. I mean, if you have a plastic cup in the morning and you're putting like your RO water in there and just drinking it, like, not a problem, right? It's more of like the storage, the long-term, the UV, the light, any other big chemicals you're worried about?
Well, so I think about a bunch in personal care products and even in home care products. So the ones that I think of that are, kind of non-specific, but can be a big problem, are just fragrance. Like, what does that mean? Fragrance.
Exactly.
Right? It's, very non-specific, but a lot of times, there's lots of stuff that goes into fragrance. And, it's so interesting because I notice, like, the more that you take these things out of your environment, generally speaking, I find the more sensitive you become to them. Like, I was just, like, a lot of times when I'll get into Ubers or stuff like that, they have air fresheners.
Oh, the
And all of
worst.
this, I'm just like, oh gosh, I have to open the windows, right? But years ago, when I wasn't as conscious about this, I didn't notice this as much. My body wasn't as sensitive and aware. And so I think we get bombarded with these things, and we almost get adapted to, all of these fragrances and chemicals. And then once you start to systematically remove them, your body actually becomes more sensitive to them, and you can pick them up more so than you may have previously.
Totally. Yeah. You can get, like, the best thing, the Uber thing drives me nuts, right? Because you can get these charcoal air filters on Amazon, these little bean bags, or you can get these little ones you put in like the air, kind of where the air is coming out. It's a much better way because then it soaks up the odor and absorbs it versus like gives some like fake smell off, right? Those are just the worst. No, I totally get it.
They're overpowering.
I think there's some companies that have little HEPA filters that'll plug into the 12 volt and also do a little filtering. So yeah, I totally agree. That makes sense. What else on the toxicity side? We talked about food. We talked about plastics, talked about hormones. I mean, we could probably talk about like Roundup and glyphosate. I mean, that's a big one because was originally patented as a herbicide, and that can negatively impact the microbiome. And that can also impact, at a toxic load to your body as well. Let's kind of go into maybe some of the pesticides or some of the glyphosate and maybe the microbiome.
Yeah. So, I mean, I think when we think about microbiome, one of the things that I didn't realize until I kind of started researching this was that mom's microbiome is passed to baby. And so
yes,
when we think about our lifestyles are kind of like a modern buzzkill to our microbiome, right? When we're stressed out. So a lot of times we're depleting our ability to digest and assimilate nutrients. The foods that we're eating might not be as fibrous or diverse. Therefore, we're not getting as diverse of a population of bacteria than we previously had or ideally would like to. Or maybe we're getting the overgrowth of certain species at the expense of other species.
Right.
And then we have, right, if we're stressed out and we're eating foods that aren't great for us, then we also have this issue of contributing to essentially leaky gut or issues where the gut lining is being thinned, and then you can start to have broader issues around immune function. So when we think about this, we think about, okay, well, ideally, right, and then we also know that birth control can contribute to, and many females are on birth control for many years, can contribute to perturbations in microbiome function as well.
Yeah.
So you have all of these assaults that can be happening from a microbiome perspective, and that microbiome can then be passed on to baby if we're not thoughtful about, balancing some of these things beforehand. And again, like the one thing I try to be conscious about this is I feel like whenever we talk about kids, we can, I try to stay away from blame and shame, right? Like if you haven't done this stuff previously, right, there is no blame and shame around this. It's, we learn when we learn, and then we try to do as well as we can with the information. So, if you've had a previous child and you weren't aware of these microbiome changes, like ideally, right, like take a breath and like be kind and gentle with yourself. Like I think that's really important. And especially when we're talking about all of these toxins and all these things, it can be very overwhelming. And so, I mean, I think you do a really good job of giving people practical suggestions of like, okay, well, now that we know this information, like what the heck can we do about it? So I just say that to say like, we're talking about all these things that can, mess with our microbiome, and right, a lot of these things are infinitely fixable, right? Like there have been some studies that, said like, if you just adopt an organic diet, for example, for a couple of weeks, like immediately, right, your body will shift, both in terms of like, getting rid of a lot of these pollutants that we're talking about are non-persistent. Some of them are persistent, but many of them are non-persistent. So once you stop including them into your diet, your body will get rid of them. Your body's incredibly resilient. And the same thing with microbiome. If we start shifting our stress load, if we start shifting the composition of foods that we're eating, our microbiome will respond very quickly. So there's a message of hope here as well.
I agree. You got to have your priority scale of how you interact with someone. So my first thing is, all right, let's just get everything organic. All right, that's organic. All right, let's focus on good proteins and good healthy fats. All right, great. Awesome. Now let's adjust the macronutrients. Let's make sure you're not overly carbing it, because just over the last 100 years, we've gone from 4 pounds of sugar to 130 pounds of sugar. So we know carbohydrate and sugar has gone up like crazy, and there is more gestational diabetes now than it's ever been. And so you can get a blood sugar meter. My general recommendation, even if you're not pregnant, you can do what's called a functional glucose tolerance. The regular glucose tolerance involves giving someone a 75-gram sugary drink. Well, unless you're a woman that's drinking sodas while you're pregnant, that's not going to have a real world application to your day in, day out life. So get a blood sugar meter, test your fasting blood sugar before you eat a meal or in the morning, and then do a 1 hour, 2 hour, 3 hour after your meal, and see how your blood sugar goes. Ideally, we want to be under that 120 or so and back below 100 within 2 to 3 hours is a pretty good recommendation. What's your thoughts on that and the blood sugar aspect of pregnancy and carb recommendations?
Oh, yeah. I mean, I'd love to get your thoughts on kind of what you think is going on with gestational diabetes in general. But I think what we see is certainly more blood sugar dysregulation. And in addition to looking at hemoglobin A1C and fasting blood sugar, we're also looking at insulin, because that tends to be a more sensitive and earlier marker of change. And what I'm observing is that there's a lot of folks that are coming in with blood sugar dysregulation, and they're being told by in traditional medicine that they're fine, but they're not feeling fine. So I think it's really important that when we think about like I love the introduction of continuous glucose monitors, or even kind of like spot tests of glucose monitors. I was, as a nutritionist, I was testing my own blood sugar before the kind of CGM movement came out. And it's fascinating to see, because, I was actually shocked at the impact that stress can have on blood sugar. And it makes sense when you think about the physiology behind it. But right, when you're not getting enough sleep, right, you're much more sensitive to blood sugar fluctuations. When you're more stressed out, your cortisol is kind of encouraging the release of more blood sugar. So there's a lot of these other components that we don't even think about when we're talking about blood sugar, rather than just the points that you were making around the consumption of blood sugar. But there are things that we can do to blunt the impact of blood sugar, and that's making sure that we're including fat and protein when we're having our carbohydrates, or including carbohydrates that have more fiber in them. So there are things that we can do to still have whole food carbohydrates in our diet, but being conscious that highly processed, hyper palatable carbohydrates are the ones that tend to not initiate our satiety mechanisms. Therefore, we want to eat more of them and more of them. And then the more we eat of them, the higher we kind of see our blood sugar flying.
Yeah, I agree. When people talk about like, well, calories in, calories out, like calories don't matter or calories do matter. Well, the issue with calories is it comes down to nutrient density and appetite regulation. And if you're eating foods that are higher in carbs and more processed, you're going to have less satiation, less nutrient density, less appetite regulation. And so anytime you start eating foods that have better cholesterol, better fats, you eat slower, you get good nutrient density from your vegetables and healthier carbohydrates that are more appropriate glycemically, you're going to have better satiation, and it's easier to eat less, right? That's a thing. And so calories do matter, but they're at the end stage. If you get the good nutrient regulation, the good apostatic type of signaling from the parts of the pituitary and hypothalamus that control appetite, that transverse nuclear part of the hypothalamus that controls satiation, you're going to naturally be more in control. So I think that's a really important component. And then you talked about blood sugar earlier. As a female in the middle of that pregnancy, right around week 20 to 30, you're going to be more insulin resistant. And so partly because your body's trying to shunt more nutrients to the baby over you, and estrogen and surges in cortisol are going to make you more insulin resistant. So you're going to be surging tons and tons and tons of insulin, and that insulin is going to affect your baby, cause it to grow, increase obesity genes epigenetically. It's going to trigger these genes, allow that baby to be bigger, which is going to allow for potentially more hospital interventions, C-sections, etc. So as a female, you got to be very careful of your carbohydrates as you get deeper in, and that's where a good blood sugar meter and testing a couple times a week, test your meals, and you kind of know. Like my wife, when she was pregnant, she had to be very careful because her blood sugar would sail up above 140 and stay for a couple hours. And she had to be like meat, veggies, good fats, and then even a little bit of a walk after her meal, or it would be sky high. So that's a thing to keep in mind, I think, too.
I think that's a really good point, because there's I think there's, the general things that we can do for that are relevant to most, people. But then I love what you're talking about is like, there is this kind of bio-individuality aspect to it. And I love the data feedback loop, because I think inputs don't always result in the outputs that we anticipate. So, right, like, for one person, having a sweet potato may cause a different reaction than another person. And so, and even on the same person on different days, right? Because we're talking about sleep and stress and all these different things.
Correct.
So monitoring blood sugar, monitoring lab testing can give us an understanding of, okay, well, we're doing these certain inputs. We're sleeping a certain amount. We're moving a certain amount. We're eating a certain diet. We suspect it's going to cause certain outputs. But when there's a disconnect between the inputs and the outputs, then we can ask the question, okay, well, what's going on here? What else might I need to modify? And so keeping a pulse on both of those things, I think, can be really helpful.
Yeah, I think so too. And the nutrient density aspect, I think, is really important. Let's talk about some micronutrient stuff. I want to get your take. I mean, iodine's one of these things I think is important. There's a lot of studies on low essential IQ in the baby if we don't get enough iodine during pregnancy. But I also worried about, from an autoimmune standpoint, getting too much and potentially triggering a Hashimoto's issue. So I think iodine's an important thing. And also I worry about fluoride too, because I've seen a lot of low IQ studies with getting too much fluoride during pregnancy. And so you got fluoridated water that could potentially be a problem too. Those are just my kind of two things out of the gate. Fluoride, be careful of it. RO water should kind of pull it out. And then making sure you're at least getting a couple hundred, maybe 500 or so micrograms extra, maybe in your multi or in supplemental iodine. Thoughts on that? And what else do you think we should be on top of as well?
Those are really interesting ones. I'm curious to look into more about the autoimmune component, because I'll talk about that in a second. But we are seeing a pretty meaningful indication of early autoimmune markers, and the literature that I've seen is suggesting that this is pretty meaningfully on the rise, and it's disproportionately present in the female population. So I certainly think it is something that we want to be keeping an eye out for. But when I think about other nutrients of concern, one big one, and this is going to seem super obvious, but why are you talking about it, is iron. Just right. I mean, we're seeing, run tons of CBCs, but I'm consistently seeing low ferritin. So CBC may be normal, but we're seeing low ferritin. And I think the stats that I've seen are 15 to 25% of pregnancies are characterized by anemia. So iron deficiency anemia, which is a pretty large number for, when we think about just how prevalent a CBC is for screening. And as I just said, right, CBC might not be the only thing we want to be looking at, right? We might want to look at iron storage. So maybe that's part of the reason why we're under-diagnosing low iron. And then you also have blood volume that's increasing pretty meaningfully in pregnancy. And so if you're kind of on that cusp, between iron deficiency and, low iron, you might be crossing over as you move into pregnancy. But iron's a really big one that I'm consistently seeing that I'm surprised by.
Yeah, and if you go into pregnancy and you're feeling really tired, that's going to be a big concern, because that's going to make quite a miserable pregnancy if you are anemic the entire pregnancy. And you're saying that the CBC, the red blood cell hemoglobin hematocrit, so your conventional or your OB may not even pick you up as being anemic, essentially.
Correct.
And so what are your strategies? Just more high quality grass-fed meat? Would you recommend like a good iron chelate? Would you recommend like a liver, grass-fed liver kind of glandular support?
Oh, I love any one of those. I mean, I think,
Okay.
so there is heme iron, non-heme iron. So from like animal sources
Right.
versus plant
Animal
sources,
sources, right? Yep.
right? I think, you're alluding to this, but yes, generally speaking, our body is able to process heme iron from animal
Yeah.
sources much more easily than we can from non-heme sources. And if we're using non-heme sources, we have to have so much more of it. And so, just I'm a big fan of like minimum effective dose and biggest bang for your buck. So when we think about iron sources, generally speaking, it's eating it with from animal sources largely.
That makes
And then
sense.
I think, right, there's certain things that you can do dietarily that kind of increase uptake and doesn't decrease the uptake. So like vitamin C paired
Yep.
with iron, so as much as possible. And then being conscious of like things that could inhibit. So we think about like teas and things like that. So being conscious about like what you're having iron with, we can be thoughtful about. One like little hack that we use is there's something called a lucky iron fish, which you can literally put in like soups, and it literally like leaches into the soups. So that's something like that's fairly simple for people to use. So that's a like small hack that we'll suggest sometimes to people. As one additional thing that you can be doing that's fairly low lift for most people.
So it's like an iron fish.
It's
And then you
literally,
like put it in.
yes, exactly as
Oh
it
my
sounds.
gosh. That's so cool.
It's kind of wild.
Awesome. Yeah. And so you're talking about ferritin, right? Heme-based iron has 95% of the input on that ferritin. So yeah, you're not going to get it with spinach and other, so-called high iron foods that are plant-based because it just doesn't move ferritin that much. We see it clinically all the time. So that's a really good point on that. Also, when you're doing things like liver, you're getting vitamin A, right? At what point is vitamin A a problem for you? Where you're like, that's a threshold that may be a little bit too high, because vitamin A, just for listeners, can be teratogenic or cause birth defects when you go too high. Now, usually this is in and around things like Accutane, which is like a synthetic kind of retin A for your skin to kind of decrease oil and sebum production. What's your take on vitamin A levels when it comes to a whole food form?
Okay, so I mean, I've never seen vitamin A from a like too high in,
Mhm.
and I'm not measuring it as regularly as I could be, but it is, I think, because there is so much caution around it that I don't generally see it high. In fact, I think we're probably under supplementing vitamin A, right? And I think there's different types of vitamin A. I think when we're getting it from our whole food sources, like from carotenoids, right, it's pretty hard to overdose on these compounds if you're getting them from your diet. When you start taking supplemental forms, then yes, we probably do want to be conscious about it. When you're talking about liver has vitamin A in it as well. And even among those who are taking liver supplements, I don't generally see people overdosing on this, but you certainly, we want to be conscious. Vitamins A, D, E, and K are all fat soluble. And so they're going to be absorbed differently depending on your body composition as well. So these are things that you probably do want to keep an eye on. But generally speaking, I think if you're getting whole food sources of these nutrients, it's pretty hard to overdose on them. It's usually through supplementation that we see
Yeah.
any sort of overdosing.
Yeah. I mean, usually you're going to see it typically above 30,000 IU, usually around 10,000 is probably safe. Again, like vitamin A in the form of liver with other B vitamins and vitamin D and other nutrients, that's a little bit different because you have all these synergy nutrients versus a synthetic retinol.
That's a great point.
Or something that doesn't have, if you're getting a good whole food or a good multi that has like mixed carotenoids or retinol palmitate from like a good like palm fruit or something like that, you can get whole food sources with other nutrients that are probably going to be less problematic. But if you're doing, a retinol vitamin A drops at high doses, or you're doing obviously Accutane, then that's going to be a problem. If it's like cod liver oil, just probably try to keep your supplemental load of vitamin D or vitamin A under probably 10,000 is my general recommendation. I think, get tested, like do a intercellular nutrient test and see where you're sitting too.
Yes, because I think I think I'm glad you bring this up, because I think most people are more at risk of being under vitamin
Yes.
A than
Yes.
over. And I actually think it's Weston A. Price who's done some really interesting studies around this, and kind of like vitamin A nutrient levels and so forth. And you were talking about cod liver oil, which I know is something that their foundation really advocates for. So I think that testing, as you're saying, is a really good way of seeing, okay, well, maybe I'm not over supplementing, maybe underneath the recommended guidance, and this could be a nutrient to optimize, and it is really important implication.
Yeah, one study talking about safety and toxicity of vitamin A, they talk about 10,000 or less, right? Really no issues. There's a mild increase as you start to go up to 20 or 30,000, but vitamin A from synthetic sources versus a whole food cod liver or beef liver, probably a little bit on the different side there. So, yeah,
it's a good distinction.
Yeah, absolutely. Now, what about husbands and wives that are trying to get pregnant and they're having fertility issues? What are the things you look at? I mean, we know women tend to get, the finger pointed at us. Oh, it has to be the woman's issue. But we know it's usually 40, 40, and 20, right? 40% the women, 40% the men, and 20% just unknown causes. And we know a lot of these same toxins and microplastics and pesticides and glyphosate can also impact men and their sperm count and motility and morphology and all that stuff. So how do you look at that and sit down with a couple that's having fertility issues? Like, what's your kind of like process?
So, I mean, I think first you said a great staging, which is that it's, biology doesn't care about our cultural construct that fertility is a female problem, right? It's literally a 50-50 biological equation. And so I think we've been doing a disservice by just looking at the female reproductive partner. And I think it's just mathematically, if you're only optimizing 50% of an equation, it is less likely that you're going to get the outcome that you want. So I think it's really important that we start inviting our male reproductive partners into this conversation in much the same way that you were just talking about. And, as you were saying, many of the same things that affect, right, our fertility are true for males and for females, right? Fertility is an extension of our overall health. We oftentimes treat it as a below the waist conversation, not on this show, but I think in broader medicine, we do, right? We look at our, below the waist, or we look at hormones, and those are absolutely part of the equation. But our fertility health is an extension of our overall health. Like, our immune health matters, our metabolic health matters, our nutrient status matters, many of the things that we're talking about. And that is true whether you are the male reproductive partner or the female reproductive partner. And I think on top of that, not only do you have the biological side, which says, if you're only optimizing 50%, you're less likely to be effective, but there's the social side, which is people are much more likely to adopt health changes or sustain a healthy lifestyle if they are doing it with the people around them. So, right, if you're cleaning up the products in your home, like we talked about, if you're upgrading your diet, if you're, modifying your movement levels, it is so much easier to do that and to stick with it, than if your friends are, and in particular, the person that you happen to be living with is also doing it. So I think there's just a practicality side of it as well.
100%. And, you can look at male testosterone and male sperm counts. They've dropped precipitously the last 100 years. So that's a big factor. And, we know toxicity, we know, whether it's pesticides, we know nutrient density. We also can just look at the big driving factor in most female infertility tends to be PCOS driven. And we know that's insulin resistant. So insulin resistance negatively impacts men because it basically turns them into women via aromatase. Aromatase takes testosterone and goes more into estrogen. But with PCOS and insulin, it's actually the opposite. Women become more androgenic, and that throws off their hormones too, because it throws off prolactin and causes aberrations in the cycle. So we have these enzymes that upregulate in each sex that cause our sexes to almost switch in a way, which is kind of ironic, if you will.
It's fascinating to look at the biochemistry and the way that you talked about it. And I think, the other thing that I think about in terms of, these factors is the movement factor, or the lack thereof movement factor, right? A lot of our jobs used to be physical in nature, like physical labor, right? And we've now moved to many, many, many more sedentary jobs. And if we just think about that, right, when we're sitting for long periods of time, I'm sitting right now, you're not, so I love that, right? But right, when we're sitting for long periods of time, we literally just compress our entire reproductive area. And that's not great for females, right? Because you cause stagnation, right? If you don't have blood flow, you don't get nutrients, you don't get oxygen. But for men, right, I think there's like the double whammy, which is you create heat. Right. And we definitely do not want to be increasing the temperature of our testicles. So, I think there's this element as well that, sedentariness, in addition to kind of the cardiovascular implications for it, there's also like the heat implications of sitting for long periods of time. So getting up and moving, separate from just exercise alone, is an important factor that I don't think a lot of people are even considering.
100%. And so when you're working with a couple, I mean, what are the big tests you like to do out of the gate?
So at Poppin, we test across 5 categories, and it's essentially meant to be a screening test. So we look at blood status, we look at hormone status, metabolic status, nutrient status, and immune status. And essentially what it does is it looks at, I designed it by looking at the clinical literature and said, okay, what are all the things that we know can interfere with fertility? And can we actually start to, instead of waiting until someone is struggling to conceive, can we actually get early indicators so that once you start the journey, you can get flags for, are there any potential red flags or yellow flags that could interfere with my ability to conceive? And it looks at a lot of the things that we've talked about already. So, do you have any nutrient deficiencies? The big ones we see are vitamin D, right? Omega-3s, we see a lot of that. Folate, B12. Do you have any hormonal imbalances? And we're not just looking at, we're looking at thyroid function, we look at sex hormones, but we're looking at the binding proteins as well, right? Because whether or not you have an ample amount of hormones, but high binding proteins, the way you would address that is different than if you have just a low hormone state, right? So understanding that, that dynamic as well is really important. Looking at metabolic function, like you were talking about, right? Do people have indicators of hormone dysregulation, right? And 50% of people that we're testing, have indicators of hormone dysregulation, whether that be elevated estrogen or elevated testosterone or, decreased testosterone. And then immune function, right? And we were talking about that. So we're looking at anti-nuclear antibody, and that's being, flagged in a lot more cases.
Makes sense. And Alexandria has a book called 9 Months is Not Enough, the ultimate pre-pregnancy checklist to create a healthy baby. So we're going to put that link, the Amazon link, right below in the description. So if you guys are listening, feel free to click down below and support her there. Also, Alexandria, are you seeing patients?
I'm not. I'm working with people through my company, Poppin.
Got it. And what's the website there?
Get Poppin, GetPoplin.com.
We'll put the link.
And
we'll put the link in the description there.
Thank you. We do pre-pregnancy testing. So it's a way for people, like what I found when I was working as a clinician is many doctors would not run the requisite testing that I was suggesting. And I think there's, now been an influx of many more functional integrative doctors who are looking at these broader panels. But I think it's really important to, rather than waiting till we're having a problem, right? Infertility in many cases is a symptom. It is not a diagnosis. So how do we get an indication of what is going on with your health and your reproductive partner's health early on in the journey so that we can start to intervene with many of the things we've talked about, diet and lifestyle and supplementation. Sometimes you may need medications and procedures in partnership with your doctor, but many times we can move the needle pretty meaningfully with, with these simpler and less invasive and less expensive interventions.
That's great. And the website is GetPoplin.
Yep.
Okay, good. We'll put the link down there, Get Poplin. And then also, is there anything else you want to leave the listeners with in regards to, enhancing pre-pregnancy fertility or healthy fertility while you're pregnant? Any other big strategies we missed?
Oh, I think we've covered most of them. I think the only other thing I would say is we didn't touch too much on stress. And I think that stress is like such a nebulous word and term. But what I think is important to understand when it comes to fertility is that your sex hormones and your stress hormones are in the same biochemical pathway. And so your body will always prioritize survival over procreation. And so if you're you're physiologically, stressed, or you're psychologically stressed, your body will perceive that as an unsafe environment to bring a baby into, and it will downregulate reproductive function. And it will shift from making your sex hormones to making your stress hormones cortisol. And so you literally will not have the raw materials that are necessary to conceive. So I think that's just a really important thing. And that, physiological stressors can be mold in your house. It can be a chronic infection that you're not aware of. Or it could be psychological stressors, like I don't like my job, or my commute every day is very, very stressful, right? So there's lots of different ways that our body can experience these stressors. And so systematically going through and trying to figure out, okay, well, what are chronic stressors, not acute stressors, because our body was meant to design those, but what are the things that we're consistently interacting with that could be draining our resources?
Okay, great. I want to just kind of leave listeners with maybe three more things for me, and then I want you to comment if you don't mind. I saw a woman, she's had a baby. It was her third or fourth baby, and she had group B strep, and they had to amputate 3 out of 4 of her limbs. It was very sad. And she's still going through this now, and it's just a sad situation. And the literature shows being on a high quality probiotic, lactobacillus acidophilus, a bifidobacter species, a good high quality one during pregnancy decreases group B strep by 80%. So I think being on a good probiotic during pregnancy is essential to decrease your risk of group B strep, because if there is an issue there, it can be devastating. Number one, making sure you're on a good quality multi that has activated folate, LMTHF folate, good whole form vitamin A, a good fish oil with extra DHEA and EPA to build healthy baby's brain. And then also making sure the nutrient density is there, because Mother Nature will always pull from the mom to give to the baby, and you'll be left with very little. So make sure there's a lot of nutrient density coming in, egg yolks, grass-fed liver, a little bit if you can, grass-fed meat, maybe some extra enzymes or bile salts if you're having a hard time digesting, or if you're more nauseous during pregnancy, or some ginger. That'd be kind of the last couple of little things I would throw in there. What are your thoughts?
I love that. So yes, so a prenatal or a multivitamin, a fish oil, I think is, incredibly important. And, probiotics, prebiotics, I think these, any sort of gut support can be incredibly important for all the reasons that we talked about earlier. And then the one other thing that I usually encourage people to add in is some sort of egg health support or sperm health support. And that's essentially mitochondrial support. So, really thinking about kind of like what are, antioxidants that can support egg health and sperm health. And especially as people are getting pregnant older, and especially as we have more assaults coming at us, right, supporting our mitochondrial health is incredibly important. So I usually recommend kind of adding a mitochondrial support supplement in as well.
Great. Any other thoughts on essentially group B strep prevention?
I don't have any other thoughts besides what you shared. I actually didn't even realize that that there was a study out there that was talking about a simple probiotic intervention reducing it by 80%. That's wild.
Yeah, I mean, there's a bunch out there that vary, but yeah, having it in there is going to definitely reduce your chances, and obviously, avoiding things that are going to have a pesticide or antibiotic-like effect, like Roundup. I mean, that's a antibiotic. Essentially, it was patented as an antibiotic when it came out decades ago, and that can negatively impact that beneficial bacteria in the gut.
Yeah, the one thing I will just say with probiotics, because I think that they can be very helpful. But what I want people to realize is that if you're putting probiotics in, right, live bacteria, it's also important to nourish them. And so we can just we can put, these probiotics in, and then we can eat crappy food, and then they're not going to take, they're not going to take seed. So I think it's really important that we're cycling basically like either probiotic based foods or probiotics through supplements, and then we're nourishing with additional prebiotics, because then I think it's important. And then I also think cycling through probiotics, if we continue to take the same probiotics over and over, we don't necessarily get the diversity that we're looking for. So, there's some nuances with probiotics that I think like allow you to get the biggest bang for your buck when you're thinking about introducing them into your diet and then supplementation regimen.
That's great. What are your favorite foods that have a prebiotic benefit, like safe starches, vegetables? What do you like for that? And what other probiotics do you like to kind of mix in there outside of just your healthy fermented foods, like maybe sauerkraut or kimchi, or good healthy pickles, or maybe a low sugar kombucha? What other thoughts on that?
Oh, low sugar kombucha. Yeah. So I think depends on what you can, digest and assimilate. But I think like, onions, garlic, these are, great for like prebiotics foods, like just adding them to a whole bunch of different products. You can even do those in oils. And that's simple. Like you can season so many different foods with just that. And then, when I think about probiotics, right, I think about kefir. And if you're not doing dairy kefir, there's also, coconut. So that, that's like, one that you can add in. Pickles are like a simple one that if you just want to throw that in. Sauerkraut. Even these things, like I think sometimes we can make it very complicated, but if you just if you have some pickles and sauerkraut, in your, and you mentioned, like, I think it was kimchi, you can just take a little spoonful, and it doesn't have to be complicated. So including in your refrigerator and just having a little, bite makes it simple as well.
Love that. Awesome. Well, feel free, guys, and ladies, feel free. Link down below. Amazon link to Alexandria's book, and we'll put Alexandria's website, GETPOPLIN, as well to get some of the pre-pregnancy testing. And anything else, Alexandria?
Thank you so much for hosting me. I would just say, what I like to tell people is you have so much more agency over your broader health and your reproductive health than you may have been led to believe. And so, there's so many levers within your agency. And so, just encourage you to advocate for yourself. And it's such a pleasure to be on shows like this, where you're just giving people so many practical resources for how do you actually do that.
Awesome. Well, thank you so much for being a great guest. Thank you.